Hi everyone, we just wanted to remind you before we start the show that today's episode is a continuation of our bonus mini-season following Season 2. After this episode, we have one more bonus episode that we know you won't want to miss, so be sure to tune back in 2 weeks. Also, as with last week, because of the ongoing novel coronavirus pandemic and the stay-at-home orders, this interview was conducted remotely. We apologize if there are any technical errors in the audio or the sounds of kids playing in the background. Again, thank you all so much for listening. Now here's today's episode.
Because it is a pandemic, because this is something that's being experienced all around the world, and that countries have different capacities for both treatment, testing, and tracing. In refugee camps, there's a lot of fear. I think one of the things to highlight with pandemics is that just as we're seeing in the US that, existing inequalities and inequities are in fact exacerbated and kind of come to light through the pandemic, the same thing is true on a global scale.
You're listening to Seeking Refuge, a podcast about the human stories behind refugees. Your host for this week is Jackie Burnett.
Today I'm here with Dr. Breanne Grace, a professor in the College of Social Work at the University of South Carolina. Hello, Dr. Grace, and welcome back to Seeking Refuge, your very first episode, and we're so excited to have you on here again.
Oh, thank you so much for having me. It's just lovely to be here virtually with you for this podcast.
So if you could start off just quickly by introducing yourself.
Sure. I'm Breanne Grace. I'm an assistant professor at the University of South Carolina in the College of Social Work. I am a sociologist by training, although I have the lovely pleasure of teaching social policy in the College of Social Work, and my research focuses on refugees, so it's quite a pleasure to be here with you today.
Thank you. Well, we're obviously in the midst of a global pandemic, and it has impacted billions of people's lives all around the world in so many different ways. And some of these stories we've heard before, and some of these we have not. The refugee story, how refugees experience outbreaks and pandemics, is one I haven't heard. And what I'm hoping you can illustrate a little bit today. So to begin, based on your experience and research working in refugee camps in East Africa, how are disease outbreaks generally experienced in the camps?
Sure. So I should say that before I got my PhD and started doing research, I worked in refugee camps. And so I worked in humanitarian aid. And so in that capacity, a lot of my job was planning for a potential pandemic that was at that time yet to be known, yet to be identified. And I worked in camps in East Africa. And during my time, there were sometimes small-scale outbreaks of different diseases in countries around the country where I worked in. So Ebola, for instance, there were sometimes small outbreaks of Ebola. And so part of my job was trying to develop strategies and plans for the camp and to consider kind of long-term planning and how do you actually keep people safe if there was to be an outbreak, either an outbreak, a small-scale outbreak, or, of course, part of a pandemic. And so it was things like checking infrastructure, checking capacity, trying to work with researchers, especially zoologists who were studying kind of animal-human transmission, trying to kind of get ahead of some of the unknowns so that if something were to occur, we would, at least have a running start in order to both address people's immediate health concerns, health needs, as well as potentially examine tracing. Now, what I'm seeing right now, though, in my research is that, because it is a pandemic, because this is something that's being experienced all around the world, and that countries have different capacities for both treatment, testing, and tracing. In refugee camps, there's a lot of fear. So as you can imagine, right now the United States is very concerned about things like ventilators. But if you're in a refugee camp, that won't even be possible. Or ventilators are very rare. And so, people are scared. If they get it, how are they going to be treated? Refugees in the United States are sending money back to help their family members prepare. So to do things like buy hand sanitizer sometimes, make sure they have enough fruits and vegetables and kind of nutritious foods, so that if they do get it, they have a better chance of surviving it. To help people travel if they are sick from refugee camps, sometimes to larger cities where they might be able to go to a hospital. There are all sorts of kind of variables here, but I think one of the things to highlight with pandemics is that just as we're seeing in the US that, existing inequalities and inequities are in fact exacerbated and kind of come to light through the pandemic, the same thing is true on a global scale, that where there is a limited health infrastructure in place, health disparities in fact grow. And places where there are limited resources for treating diseases, those places, it's a little bit scary to be in those places and a little more uncertain.
You mentioned that in the United States, we're all worried about having enough ventilators in refugee camps. That's not a worry because it's worrying about having like even one, or that they don't have enough. Is this due to a lack of funding, or is this the countries that are like a lack of funding in general, or are the countries allocating funding to more like central hospitals, or why don't they have any ventilators?
Yeah, well, so I should start by saying it varies a lot by country, right? So not all refugee camps are the same, and not all refugee camps have the same infrastructure. But in many of the camps where I worked, the infrastructure is highly dependent upon UNHCR. And so it's not that UNHCR isn't putting funding in, but it's more that there are real challenges for creating a robust health infrastructure in refugee camps. And in fact, many of the countries overall don't have the health infrastructure, particularly in rural areas where refugee camps tend to be located. So it's not that necessarily refugee camps are being neglected per se, but more that the countries themselves in general just don't have the infrastructure, especially in rural areas. So not only are there significant health disparities kind of between people who have resources to seek private health care and people who don't, but also between rural and urban. So in Tanzania, for instance, right now, there's a lot of political concern about the virus and about the capacity of hospitals to be able to treat in general. Now, in refugee camps, it's not that it is also an issue, right? So just like in rural Tanzania, hospitals don't have the ventilators or the capacity to treat, extreme cases of COVID-19. The same is true in refugee camps. And, there are a number of limitations. So there are shortages of doctors. There are in some places, in rural areas isn't electricity that you would need to run a ventilator. Sanitation, there are sanitation shortages where clean water isn't directly available, or piped clean water isn't available. There are a lot of different issues at play here. And so refugee camps, are similarly situated where they too lack some of those resources to really be able to address and treat.
In the United States, one way we have tried to slow the spread of the pandemic is by social distancing and staying at home and staying 6 feet away from people. Does the lack of adequate room in refugee camps, the tents or the buildings right next to each other, does that make outbreaks more severe?
Yeah, I mean, it absolutely can. It's not only that the buildings are right next to each other, but they're shared bathroom facilities often. And so, yeah, it's not only the proximity, but the number of shared spaces where people have to go in order to have their basic needs met. So accessing food, accessing water, accessing bathroom facilities, all of these spaces are kind of shared spaces. And so not only is it really difficult to socially distance because of kind of proximity, but it's really hard to maintain any shared level of sanitation because so many of those spaces are shared.
It seems to me more like a college dorm or college campus, in that you have so many people in one area sharing all these facilities. And we've been lucky enough to be able to go home from college campuses. But if you can't do that, then that seems like a area that's just ripe for outbreaks to spread very quickly.
Yes, that is absolutely one way to think of it. It's like a college dorm if the buildings were much more rudimentary and there was no piped water. Or indoor plumbing, actually, is the better way to say it.
Around the world, countries are restricting international travel and immigration. President Trump recently issued an executive order suspending all immigration to the United States for 60 days. How has this impacted President Trump's example and others, refugees either fleeing persecution or seeking resettlement?
Yeah, so on the one hand, it's really easy to think about this as something related to COVID-19, but I think that would be a mistake. So, we are in what is now a long trajectory of restrictionist immigration policy, and this is just a continuation of that in the name of the disease. So yes, these policies will definitely hurt people, especially family reunification cases. And it really hurts people who are seeking green card or spousal reunification. But the refugee program has already been cut fairly drastically. Overseas processing has already stopped. So in some ways it hurts refugee resettlement less, but that's only because refugee resettlement is now at its lowest level ever. And so, this is part of a longer trajectory of restrictionist immigration policies. Now, on a global scale, there are concerns about, for instance, humanitarian aid to asylum seekers in the Mediterranean, where because of the cutbacks to coast guards, there are reports of people not being rescued, more people dying at sea, things like that. I think that the other thing is because there's so much economic instability, we see a lot of immigrants and refugees being scapegoated and a lot of kind of xenophobia that is emerging through this. And so some of the examples of what we are seeing in the United States is actually like an increase in hate crimes directed at refugees from Asian countries. So while, the hate crimes often invoke China, they're not limited to being, committed against only Chinese nationals, right? We see it against Asian Americans, we see it against refugees from Asian countries. And so it's problematic on a number of levels.
In one of your articles, you've discussed the violence of uncertainty, which, correct me if I'm wrong, is how policies in the United States concerning resettled refugees are either unclear or rapidly changing, which means that refugees then face fear and uncertainty around certain actions, such as going to school or even to the doctor. How might this phenomenon impact a resettled refugee's experience of pandemics, such as the one we're in?
Yeah, so right now, one of the things that I am seeing a lot of refugees respond to is something called the Public Charge Act. And so there was a recent policy change through an executive order from President Trump that made, that essentially said that immigrants who are seeking social services can be denied citizenship for using services, particular services. Now, let me say that it is both a broad order and a vague order. And it's not actually the order itself, but the idea of the order that is scaring people. So the idea that something you could have done before you knew about this could be used against you to deny you citizenship or a green card in the future is really scary, right? You think you're doing everything right, and then suddenly 6 years from now, somebody's holding that against you. And so it's not even the specific criteria within the order, but the fact that social services are kind of being weaponized, that is scaring some refugees. And so right now with COVID-19, one of the things that we're seeing is that people are afraid of accessing healthcare, of getting tested, of even using health services in general, because they're afraid that sometime down the line it will be used against them to deny them citizenship. And so it's really scary. I mean, what do you know, it's kind of this thought that all of the social services that are supposed to support you now suddenly could actually be kind of weaponized against you. So that's one of the things that we're seeing, where kind of the uncertainty that law created caused a lot of upheaval in people's lives. In that article, we also talk about hate crimes. So, the increase in hate crimes is also part of that, where, the uncertainty is that you arrive in the United States and you expect to be socially supported, to be welcomed. You're kind of told that, because of what you've experienced as a refugee, now the United States wants you, and only to arrive and to experience violence from your neighbors. And so I think COVID-19 is a great example of that, where people from Burma, for instance, are arriving in the United States and then experiencing hate crimes and violence because people are calling them Chinese immigrants. And so it's both extremely confusing and extremely scary, where you don't understand what's going on or why it's happening. I will also say that this is something that we are seeing with people who also arrived as refugees 30 or more years ago, where, maybe you came from Vietnam, or your parents came from Vietnam a long time ago, and now you are being targeted as being anti-American. And not only are you a citizen, or perhaps you were even born here, that your parents came as refugees and you were born in the United States, but suddenly this anti-Asian sentiment is being kind of weaponized against people. And that's pretty scary, where it's, your Americanness is in question, or your welcome, or your belonging here. And it's scary.
Have hate crimes against refugees been steadily increasing, and then is the increase in hate crimes due to COVID-19, is that simply part of a trend that has been happening for the past few decades, probably?
So hate crimes against certain populations, particularly Muslim refugees, have been rising since September 11th. So, but against Asian immigrants and refugees, the data is less clear. But there has definitely been an uptick since kind of January. And so, so I should say that hate crime data is incredibly difficult to study anyways, and that it's mostly because most hate crimes do not get reported, because the same thing that causes the hate crime also leads you to fear reporting the hate crime, if that makes sense. A distrust of the Americans around you, or the government and the systems around you. And so, but one thing we do know is that there has been a rise in anti-Asian sentiment, and an increase in the number of hate crimes against Asian Americans, Asian immigrants, Asian refugees. It's hard to, yes, it is rising, but we don't know how much it is rising, because it is so poorly reported, so poorly studied, and people don't report out of fear, which is often a legitimate fear, especially if you're facing violence.
In addition to this fear of going to the doctor, of getting tested for COVID-19 or getting treatment, what other barriers do resettled refugees face to being prepared for a pandemic and getting treatment? To my mind comes like language or economic, if you have economic barriers. So if you could speak to that.
Yeah, absolutely. So language in healthcare settings is a huge barrier, as you suggest. So, improper interpretation in hospital settings is a barrier that refugees face, especially if they come from places with fairly rare, or sometimes they're called least commonly taught languages, or languages that are a little bit more obscure. And so, or if they are able to get interpretation through something like Language Line, which is a tele-interpretation service, sometimes particular dialects can be difficult to access, where people, right, you might speak the right language, but it doesn't necessarily mean that you understand the person who's on the other side of the phone. And so that can be a huge challenge. It can also be a huge challenge as you think about describing symptoms, where there is a real specificity that is going on right now in the screening process with COVID-19, where, because there's such a shortage in the number of tests, not only is it challenging for people to get tested, but it's especially challenging for people to get tested when English is not their first language, and they may not have the really hyper nuanced language that's required in some of these screening protocols. And so that's been a challenge. Economic barriers are huge. Refugees tend to work in precarious positions immediately upon arrival. So refugees who are fairly new arrivals often work in low-wage jobs and are already economically precarious. And so, if you're laid off, you often don't have the savings in place in order to access, or to continue to survive. Likewise, state to state, there's some variation in unemployment benefits and when people are eligible for unemployment, and that can affect people. Also, refugees sometimes work in industries that put people in very close contact. So like meat processing plants, where people are working on a line in very, very close contact, doing very dangerous work. And we're seeing a number of outbreaks in places like meat processing plants across the country, where, huge numbers of people all working the same shift become infected. And so, refugees face a lot of challenges right now, especially newly arrived refugees, whether it be economic, whether it be social, whether it be about health. Yeah, there are a lot of challenges.
I know it varies state to state, but are refugees who have not yet become past that 1 year and become green card holders or are not yet citizens, are they eligible for unemployment benefits?
That's a great question, and I know it varies state to state, but I don't know what the baseline kind of minimum is, but that is a good question. I'll have to look it up.
Also, are resettlement agencies, I know it also probably varies state to state, are resettlement agencies considered essential businesses and allowed to stay open and continue helping refugees? And are those language classes and employment classes continuing?
It does vary a lot state to state. I think in most states, the language classes have been put on hold. I think some services are considered essential services, such as case management, but how they're actually operationalized is different. So I know in some locations, there is kind of case management going on, where people are calling to check in on their refugee clients. In some places it continues in person, but that has a lot to do with kind of state definitions of essential services and kind of state interest.
Thank you so much. Is there anything on your mind that you want to say to our listeners? Anything that I haven't covered that you really want people to hear?
Oh goodness, that's a good question. I think that one of the things about pandemics is that it brings out or highlights the inequities that already exist in our society. And for many refugee families, some of the barriers that they already face in the United States and in refugee camps and kind of everywhere in the world, those barriers, those inequities are really being brought to the fore. And it's also those inequities that often make people the most vulnerable to disease. So things like limited access to nutritious foods, limited access to healthcare, language barriers in healthcare settings, living conditions that are less than secure. And I think as kind of both in the United States as a country that welcomes refugees as well as globally, one of our real challenges after this will be to think hard about how do we rectify some of these situations and how do we especially find the political will to ensure that people have the basic things that they need in order to live and survive. Pandemics highlight how communities are all interconnected and how my health is dependent upon your health. And so as we kind of continue to deny people basic services, what we're really doing is denying, our community health in general. So my hope is that this might highlight for us not only why is it kind of a human rights issue to provide, for instance, healthcare to everyone, but also to highlight why someone else's healthcare access is intricately tied to my healthcare access, and to motivate political change moving forward.
That's a great point. It seems, if only for purely selfish reasons, that a lot of these, the uncertainty with refugees that discourages them from going to the doctor only hurts myself or only hurts your own health because of the nature of pandemics. So even for just purely selfish reasons, if that's all you're looking at, it seems counterintuitive, a lot of these measures.
That's right. I mean, I really wish that, human rights messaging really resonated with everyone and would really motivate change. The human rights messaging alone would motivate change, but clearly that hasn't happened over the past 50, 60 years. And so if that's not going to resonate, what do we actually need to see? And I can think of, nothing that motivates people more than their own health outcomes. And so perhaps this will help with that.
Well, thank you so much for talking with me today and for illuminating the refugees story concerning refugees just a little bit more.
Yes, it's been my pleasure. Thank you.
Thank you so much for listening to this bonus episode of Seeking Refuge. If you want to get into contact with us, you can email us at seekingrefugepodcast@gmail.com or follow us at Refuge Podcast on Twitter. Also, a huge thanks to Maxey International House for making this show possible. This show comes out every 2 weeks, so subscribe, rate us on iTunes, and we'll see you in the next one.